In our community, many of our neighbors still face a stark reality. Access to healthcare is often out of reach until it's an emergency. At Fredericksburg Christian Health Center, we're committed to meeting people where they are, partnering with others to bring healthcare directly to those in need before the crisis strikes. To understand how we're tackling these challenges, let's hear from Dr. Stinar and Dr. Tremontozzi about the work being done and the vision that drives it.
Hey Dan, thanks for coming over today and talking with me about the healthcare needs in our community.
Absolutely.
What's your experience been?
I've been practicing in Fredericksburg over 20 years, and I've seen a lot of changes. One of the big changes that I saw was we expanded access for Medicaid. A lot of people, that in the past couldn't get any kind of insurance, now could get it, through the state.
Before, maybe about 20% of the population is uninsured. Now it's less than 10%.
Sure.
And so for our services, we were doing, a good 35% or more uninsured care. And now that's down to less than 10% also. And yeah, we're still seeing the Medicaid patients. That's still about like 30% of our services, but it's not the same.
The needs of the uninsured and the needs of people that are on Medicaid are very similar.
Yeah.
Very similar barriers to care. And one of those barriers is actually getting into the clinic to see doctors.
People have transportation issues or can't get away from work or social circumstances. Now that a good portion of our patients who were uninsured have Medicaid, and although Medicaid doesn't pay much, it pays more than nothing, we do have some excess funds. Like how can FCHC use some of the resources we have to even serve the community better?
Theron, I really feel that God is directing us and leading us to take our services out to the community, outside our walls, to the people that are actually hurting.
So we're going out of the clinic and providing care in the community.
Exactly. Even partnering with these other ministries.
Yeah, that's what we need to do.
Let's do it.
Let's do it.
Bringing healthcare into the community is nothing new for FCHC. Through our HealthBridge program, we regularly partner with organizations like Micah Ministries and Empower House, ensuring that care reaches people where they need it most.
So Dr. Stinar, where are we headed today?
This morning we are off to the Micah Day Center. The great need in our community right now is not necessarily uninsured patients coming into the clinic, but really the patients who are homeless or are living in shelters or community centers, and they have difficulty accessing the traditional healthcare system. So we are bringing the care to them. We are heading towards Micah's Day Center. We're going to stop at the Italian station on the way and pick up a box of coffee. I always like to bring coffee and sometimes treats as well when I go and take care of our neighbors through Micah Ministries.
Hi, Dr. Stinar.
Hey, Anita. Hi, Carolyn. Good morning.
Good morning.
How are you guys doing today?
Doing well. How are you?
I am doing good. Ready to go serve the folks at Micah.
Thank you, Dr. Stinar, for taking care of our unhoused neighbors at Micah.
Absolutely. I appreciate your guys' support. I'll see
you next Thursday.
Yep. See you next week.
A lot of times people think of Micah as the people that address basic needs and help people survive on the street. That is a part of what we do, but basic needs are a conduit to the relationships we seek to have with people so that we can help them to address some of the other things that might be holding them back. It's really a brave task sometimes for a lot of our neighbors to even walk into our doors. We have found that it's more successful if we can bring the resources that people need to them into a place that is comfortable to them. Through HealthBridge, Dr. Stinar and Dr. Crawford come here to our day center, and they're able to meet with a medical provider right in a place that is accessible and the pressure is off. We're finding that it actually helps people to be more successful with care.
I was in a terrible car accident in 2016. I flipped the car 10 times and took out 2 electric poles, and I died. They brought me back to life, and ever since I've been having seizures and withdrawals and panic attacks. At that time, I didn't have no medicine. I didn't have a doctor. Micah helped me out 2 years ago when I first got here. They got me with Dr. Stinar, and I have a neurologist as well that Dr. Stinar set me up with, and I've been with him for 2 years. I got all my medicine. and my brain feels better. I feel better. And I'm just trying to get more help as I'm going along, because puzzle piece after puzzle piece after puzzle piece, you're putting it all together, making this big, beautiful picture.
People become homeless when they run out of relationships. What HealthBridge is doing for Micah takes us back to the core of responding to people relationally in the ways and the places and the spaces that make sense.
In addition to Micah Ministries, are there any other organizations that we go to in the community right now?
Yeah, right now we are also partnering with Empower House. And so every week, our fantastic physician assistant, Kirsty, goes out to Empower House and takes care of the women and children that are being served there. And she'll visit both their main offices as well as go to the shelter as well.
We are a private nonprofit community-based agency that provides support services for survivors and their children who have experienced intimate partner violence. 1 in 4 women and 1 in 9 men will experience violence at the hands of an intimate partner in the course of their lifetime. Over 10 million children a year are exposed to domestic violence in their homes. Many survivors of domestic violence do not access health care for a myriad of reasons. They may lack transportation, they may lack a support system because they've been isolated due to those power and control tactics. There are so many other things happening that their health care also starts to go lower and lower on the list of priorities in that home. FCHC has not only opened their doors and their services, but they've opened their hearts. And that's really critical because our clients are in some of the worst, most traumatic, frightening times for themselves and their children, knowing that they can come somewhere where someone's going to listen to them and really take the time to sit with them and ask what are their healthcare needs. And there may be things they may not realize is a need. And so to get an assessment, a consultation, to get that wellness check is really, really critical for them.
Our district is really big in terms of geography and population. Representative Abigail Spanberger put out a request for projects that might need funding. And the Rappahannock Area Health District really saw this as an opportunity to put a bid out there for getting a mobile health unit for us. Our region is very focused on Fredericksburg. That's where a lot of our health services are. And then we kind of have the expectation that people are going to come to Fredericksburg to receive those services. And especially as you get out to the more rural areas, you're looking at, where people might be driving 30, 40 plus minutes in order to get medical care. And so we saw that as a good opportunity to be able to bring that care to them. We really believe that having a mobile clinic is going to allow us to better connect people to care. If transportation is a barrier for them, we want to help overcome that barrier by having the mobile clinic that's going to bring the healthcare services right to their doorstep. We as the health department won't be able to use that clinic every day. We just don't have the staff to be essentially adding another site that's going to be traveling around throughout our community. So that's where we really want to be able to work with folks like Dr. Stinar to help make use of this new resource that we have. They can help close that loop on some primary care services that we ourselves cannot provide. I can say with confidence that everybody from Fredericksburg Christian Health that my team and I have interacted with have really been wonderful and so supportive and just open to trying things that are going to meet the needs of our community, and that really goes a long way.
With the vision of a mobile health clinic on the horizon for 2025, FCHC has been asked to provide primary care services on the ground, but the need for accessible healthcare extends far beyond the city. In rural areas of our district, many face even greater challenges just trying to reach a provider.
We serve definitely beyond the 22401, 22407 zip code. We have people from Caroline County, from King George, from, just all over. So it's definitely not just the Route 3 corridor.
Our clinic is able to meet a need where there has previously not been a solution. There's people right here that would really benefit from our services, for the ability for Fredericksburg Christian Health Center to go to them and reach them where they're at, so that transportation is no longer a barrier, so that their location where they live and
where they call home is not a barrier to their health.
Well, we have a lot of community partners that bring patients to the clinic, and they've expressed desire for us to go help them out on site as well. And so we're hoping to create the bandwidth, both in our staffing as well as the funding, to be able to do this. As you imagine, our medical providers stepping away from the clinic and not generating revenue in the clinic means there's a greater need for us to generate revenue through fundraising and grants to be able to do this more. So as we build out that bandwidth, there's other partners in the community that we'd like to do this with as well.
When mothers arrive on the front porch of Beauty for Ashes, they are full of guilt and shame, but they also are defeated because they have not been able to give up whatever their life-controlling problem is, not even for the love of their child. Beauty for Ashes is a 12 to 18-month program for women who struggle with addiction, but specifically pregnant women and women who have children. The beauty of Beauty for Ashes is that mother and child can dwell together in our program and grow and heal and develop together without separation. The way that we care for our families at Beauty for Ashes is very intentional. So a doctor's appointment involves not just mother or mother and child or child, it involves our staff also. So our moms don't have vehicles. So a staff member has to drive them, willingly drives them to a doctor's appointment. And then we remain with that mother or that mother and child during the whole appointment because we're like a family member to them. Bringing healthcare to Beauty for Ashes would be, I don't know any other way to put it, but a game changer. It would be a huge blessing. Just the factor that there's this mobile unit, and not just any mobile unit, but a mobile unit from Fredericksburg Christian Health Center, people of faith going out into our community, not just with medical care, but soul care. That to me is just unbelievable. I mean, that's God's heartbeat. What I love about Fredericksburg Christian Health Center is that they see beyond our girls' past. And our girls can be completely honest there and know that they're going to still get quality care. And not just that, but people who care.
The primary mission of Mary Shelter is to see a woman who's, for one of a million reasons, not able to take care of her children properly, or not feeling comfortable or safe in having another child, or not ever seeing a vision where they could possibly be in some sort of independent living or housing. We have a lot of moms who come here who don't have any health care. And we have a lot of moms that come here that are on Medicaid. And even with Medicaid, a lot of the doctor's offices, they have a certain percentage of their clients that they can take in that have Medicaid, and these women have literally no place to go except maybe the emergency room at the hospital. And then they do get billed. They do get some pretty big bills sometimes. So if we have somebody here that really needs to see a doctor and they have Medicaid or they have no insurance, we always tell them about the Fredericksburg Christian Health Center. Like, call this number. They will see you. You will get in. And I think the experiences that we've gotten back, I think the moms, it's been great.
They have helped me and my kids so much. My daughter is autistic, so they helped us get into UVA so she can get fully diagnosed. They helped us get her in therapy. They helped me with him when he was preemie, when he just got out of the hospital. So they've helped us so much. The staff is amazing. Having kids and then put them in the car and then having to drive is so much easier to be at home. It will be great for them to come to us.
So a lot of times, Uber drivers won't even take them because they can't fit all the car seats in. And I understand that. They need to keep it safe too. And so for not only women that live here, but I could see for a lot of the ministries in town, or just for folks in the community,
it really is a hardship to get somewhere. And I think that really holds people back from getting health care.
In the evolution of services within the community, there's always a desire to bring services to people in ways that meet them where they are and uplift them from where they are. We're glad that FCHC is on the brink of making mobility of healthcare something that is available in the community, and I think will be essential to the community to make sure that access and convenience is underlying great service. We've been working with Fredericksburg Christian Health Center for a number of years now, and the main way we started that relationship was they were a great venue for some of our mobile distribution services within the community. And one of the things that has evolved most recently then is them becoming an established site for our food is medicine programming and the ability to deliver upon that in terms of giving healthy nutritional options to patients right there at the center as they're leaving their checkups or their appointments. Across our region, which encompasses about 500,000 people, 1 in 12 of those people would be facing food insecurity. That's a startling number to so many. It's almost 38,000 people when you look at it statistically. But I think behind the statistics, we have to recognize that there's people, that we are dealing with people who have real needs, not just a number or a faceless person. We just really admire that FCHC looks creatively at people as holistic beings. Their ability to look at the healthcare of a person and see that there are other aspects of that person that need to be served and need to be healed. And they call upon us as an example of partners within the community who can help them look at the holistic care of the person they're seeing.
As we've seen, Fredericksburg Christian Health Center has made a powerful impact through partnerships and outreach efforts, but our mission doesn't stop here. The next step is to take healthcare beyond the clinic walls directly to those in need. By expanding our HealthBridge program and introducing a mobile health clinic with the Rappahannock Area Health District, we'll reach more of our neighbors, providing care when it's needed most. This is how we live out our calling to love our neighbors.
Jesus taught us that we are to love our neighbor as ourselves and to help those who are poor, sick, hungry, lonely, have been treated unjustly, the least of these.
Will you help FCHC as we love our neighbors
and fulfill our vision of seeing Christ bring healing and wholeness to our community?